AxiaLIF 2L, the least invasive solution to L4-S1 two-level fusion. The operating room setup fits conveniently on a Mayo stand and follows the procedure sequentially from left to right. First, the paracoccygeal notch is palpated and a 2 cm incision is made lateral to the coccyx. A blunt guide pin introducer is inserted and advanced along the midline of the anterior sacral surface with fluoroscopic monitoring. At approximately the S1-S2 junction, a guide pin is engaged and tapped into L5. Once the guide wire is engaged, a series of sequential dilators are used to create a working channel. A dilator sheath is attached to the 10 mm dilator. The dilator sheath is left in the sacrum to create a transosseous working channel. A 9 mm cannulated drill is used to drill into the L5-S1 disc space. The 8 mm dilator is then used to remove the 10 mm sheath. A 12 mm dilator and sheath is then inserted into the working channel. The 12 mm dilator is then removed and the 12 mm sheath is left in place. A 10.5 mm drill is then used to drill into the L5-S1 disc space. A series of nitinol disc cutters, varying in length and cutting actions, is used to prepare the disc space. Each of the 4 cutters is designed to debulk the nucleus pulposus and lightly abrade the vertebral end plates circumferentially up to the 3 cm footprint while creating a bleeding bed for fusion. Tissue extractors are used intermittently between the 4 cutters to extract the diseased disc. A bone graft inserter then follows to fill the disc space with a mixture of autologous blood and demineralized bone material. The 9 mm drill is used to drill through the inferior end plate of L5. A 12 mm dilator is reinserted into the 12 mm sheath. The 12 mm sheath is advanced until it is flush with the inferior end plate of L5, sealing off the working channel from bone graft material. A 9 mm two-level drill is then advanced through the working channel and into the L4-L5 disc space. A second discectomy is performed at the L4-L5 level using the same series of nitinol disc cutters. The tissue extractors are again used intermittently to extract the diseased disc. The bone graft inserter then follows to fill the disc space with a mixture of autologous blood and demineralized bone material. With the assistance of the AxiaLIF 2L templates, the 7.5 mm two-level drill is advanced into the L4 vertebral body. To determine the length of the L4-L5 rod, the 2L guide wire is inserted to the end of the working channel and retracted back to the inferior end plate of the L5 vertebral body. The 2L guide wire is then reinserted and an exchange sequence occurs to establish the working channel for implantation of the L4-L5 rod. The 2-level exchange bushing is inserted over the 2L guide wire. Then, the 2-level exchange cannula is inserted over the bushing. While holding the exchange cannula on the face of the sacrum, the fixation wire is inserted to keep the exchange cannula in place. The bushing is then removed. The L4-L5 rod is delivered over the guide wire. The L4-L5 rod is designed to distract the vertebral bodies, restore disc height, and indirectly decompress the neural foramen. To determine the length of the S1 rod, use the AxiaLIF 2L templates, or use a similar method as described previously. Following the implantation of the L4-L5 rod, the S1 rod is introduced and engaged with the proximal end of the L4-L5 rod. The S1 rod is designed to connect with the L4-L5 rod, and is designed to distract the vertebral bodies, restore disc height, and indirectly decompress the neural foramen by pushing off of the L4-L5 rod. A rod plug is then used to fill the cannulation of the axial rod. The AxiaLIF procedure is complete via posterior instrumentation with either pedicle screws or facet screws. AxiaLIF 2L, the least invasive solution to L4-S1 two-level fusion.